සුබ දවසක් වේවා හැමෝටම. අපි අද පටන් ගන්න යන්නේ ෆාමසි එක්ස්ටර්නල් කෝස් පේපර් ක්ලාස් එකේ 11 වෙනි පේපර් එක. ඔයාලට මොන හරි අපහසු දැනක් තියෙනවා මට WhatsApp message එකක් දාන්න 077 18 46 911ට 077 18 46 911ට channel එකට subscribe කරන්න කියලා ආරාධනා කරනවා. ඒ වගේම like එකක් දාන්න, comment එකක් දාන්න. හරි අපි යමු පේපර් එකට. True or false about drugs used in management of angina? Glyceryl trinitrate tablets are effective in prevention of angina. True. Isosorbide dinitrate dilates coronary vessels. True. Isosorbide mononitrate does not produce headache as a side effect. Sildenafil should not be given to patient taking nitrate. False. Diltiazem belongs to the nitrate family of drugs. True. Devani prashna tabiyam. True or false? Gemfibrozil belongs to the family of statins. False. B. Atorvastatin reduce cholesterol absorption from the bowel. False. C. Alcohol use in caution in those prescribed Srivastatin. True. Statins do not cause hepatic damage. False. Lovastatin is known to cause myositis. True. Nifedipine cause bradycardia. True. Clopidogrel is an anticoagulant drug. True. Aspirin is used in high doses for antiplatelet action. False. Warfarin sodium is an angiotensin II receptor antagonist. False. Philodipine is a sympathogenic. False. True or false? Nebulized salbutamol is used in treatment of acute attacks. True. Salbutamol causes bradycardia. False. Prednisolone is used for the treatment of severe attacks. True. Terbutaline belongs to the theophylline group of drugs. False. Sodium chromoglycate is used for prevention. True. Salbutamol is a beta stimulant. True. Causes bradycardia. False. Is used in nebulized form to treat acute asthma. True. Should not be used by patients who are also taking steroid inhalers. False. Has anti-inflammatory properties. False. True or false? Salbutamol is sympathogenic drug. True. Salbutamol is known to produce tachycardia. True. Salbutamol has cough suppression properties. False. Salbutamol nebulization is recommended in acute asthma. True. Ipratropium acts by stimulating beta receptors. False. Regarding drugs used in management of bronchial asthma, salbutamol is a symptom reliever. True. Inhaled salbutamol is known to cause tremor as a side effect. False. Continued use of salbutamol is known to cause tolerance. False. Theophylline has a narrow therapeutic index. False. Inhaled corticosteroid is administered only when the patient is symptomatic. False. According to British Pharmacopoeia, very soluble means that one part of the medium. True. Sucrose is very soluble in water. True. Iodine is less soluble in water compared to its solubility in aqueous solution of potassium iodide. True. Vitamin D is soluble in arachis oil. True. Benzoic acid is more soluble in water than sodium benzoate. False. Absorption of drugs taken by orally would be influenced by type of dosage form. True. Lipid solubility of the drug. True. Gastric empty rate. True. pH of the GIT. True. Particle size of the drug. True. Asthma. Asthma is defined as chronic inflammatory disease of airways that is characterized by increase responsiveness of tracheobronchial 3 to a multiplicity of stimuli. Bronchial asthma can be defined as syndrome where there is current reversible obstruction to the airways drugs groups of asthma bronchodilators, bronchodilators, short-acting beta 2 agonist, beta 2 agonist, long-acting beta 2 agonist, antimuscarinic bronchodilators, theophylline derivatives, corticosteroids, cough suppressants, bronchodilators, salbutamol, terbutaline. Side effect, tremor, tachycardia, palpitation, arrhythmia, hypokalemia, short-acting beta 2 agonist, salbutamol, terbutaline, long-acting beta 2 agonist, salmeterol, only available as inhalers, Antimuscarinic, antimuscarinic bronchodilators, bronchodilators. Ipratropium bromide, ipratropium bromide, in acute asthma, used for nebulization, side effect, dry mouth, nausea, constipation, theophylline derivatives, theophylline, aminopylline. Theophylline inhibit phosphodiesters which break down and given leading action of bronchodilation are considered as having less bronchodilate efficacy than salbutamol. Practice points. Oral theophylline are not for management of acute asthma. They are not considered first-line therapy. These medicines are unsuitable when immediate bronchodilator is needed. Use of theophylline is declining. However, they can still be used in those with moderate asthma, as an alternative to increase, to increase. Dose of, dose of. Inhale steroids, inhale steroids, inhale steroids. Long acting, long acting. Oral, oral. Theophylline, theophylline. Can be used to, can be used to, used to. Manage, manage. Nocturnal, nocturnal, nocturnal. Asthma, asthma. Aspiration, aspiration. Need not, need not, need not. Get up in the, get up in the, in the. Night, night. To use inhalers, to use inhalers. Theophylines have, theophylines have narrow therapeutic index, narrow therapeutic index, index. Adjust dose, adjust dose according to, clinical response, clinical response and plasma concentrations, concentrations. Don't give, don't give. Bolus, bolus. IV theophylline, IV theophylline. Aminophyllin, aminophyllin. Intravenous, intravenous. Aminophyllin, aminophyllin, aminophyllin. Is added, is added. When it's decided that the response to nebulized salbutamol is inadequate dose, so inadequate or so unsuitable to be used alone. Manage acute severe asthma, patient advice, patient advice, patient advice, advice. Useful, useful. Proof of medicine, proof of medicine, medicine. That are, that are. Used to, used to. Control asthma, control asthma. Don't reduce, don't reduce, reduce. The dose, the dose, the dose. Oyster, oyster. Medicine on your, medicine on your own, on your own. User, use a spacer, spacer. If MDI, MDI used. Rinse the mouth, rinse the mouth, the mouth. After every dose, after every dose, every dose. Using a spacer, using a spacer, using a spacer, spacer. Reduces, reduces oral deposition of medicine, deposition of medicine, of medicine. This will reduce the, this will reduce the, reduce the, reduce the tendency, tendency, tendency to develop, to develop, to develop. Candida, candida. Infection, infection of the throat, of the throat, 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 throat. हरी अब यदि इवरे करे क्वेश्चन पेपर है क्वेश्चन पेपर है पेपर 11 තමයි ඉවර කරේ මොනවා හරි ගැටලුවක් තිබුණොත් මට WhatsApp එකේ තියලා දෙන්න මොනවා හරි ගැටලුවක් තිබුණොත් questions WhatsApp 077යි 18යි 46යි 911ට channel එකට subscribe කරන්න කියලා ආරාධනා කරනවා. එතකොට like කරන්න, comment කරන්න. හැමෝටම සුබ දවසක්. අපි ඊළඟ පේපර් එකේ හමුවෙමු.